actually had LASIK just yesterday. She attended a seminar a few months ago, but she had the surgery yesterday. Before LASIK was $2,400, and today is $2,015.
And you know what? Good morning. I can read that print in the back. When I was sitting there, and I was like, oh wow, I can read that.
Explain to them why you're wearing those.
Okay, so I'm sorry, I got excited. I had the surgery yesterday. I'm wearing the glasses so that I don't accidentally like touch my eyes or anything. So I need to wear the glasses for 5 days, just as a preventative measure. But I don't need them. I just have them on. Clear lenses. This is great. I can see it.
She was in your chair probably 6 weeks ago. She came to a seminar. She had a lot of work responsibilities, so she set it up for June. And so she came in yesterday.
We're so glad.
How long does the actual procedure take?
Oh, we're going to go into all that, but it's basically 5 minutes in one room and about 10 minutes in another.
Wow.
Yes. We use 2 lasers, and we'll get into that body. Thank you, Nico.
Thank you. I waited 10 years, and I'm so glad.
Thank you.
And next we have Roger, and he had LASIK on May 22nd, and he is going to come up here with his wife, Gail, who also had LASIK. She had LASIK just a few days ago. Roger, before his LASIK, was $2,200, now is $2,020. And Gail, his wife, had LASIK just this past week. Before LASIK was $21,000 and is now $2,020.
You want to go first?
I always thought that it was not a candidate. You know, they tell you your eyes are so bad. 21,000. I mean, I was like blind. And so when I came in, I knew that if I was going to be a candidate, I would do it that day. But I didn't know. So fortunately, I was, and I did it that day. And the next morning, and I'm like Nico, I'm just wearing these for protection. But I woke up the next day after surgery, and it was like a miracle. I woke up, I could see outside, and one of the big questions for me when I did the LASIK was I going to have monovision? Because I really wanted not to have to wear reading glasses or driving. So I was a little concerned about that, and I went ahead and did the monovision, and I'm very glad I did. So if that's a question that any of you are thinking about, that was one of the things that was a big thing for me.
And it was a big thing for her because she had an experience with monovision with contacts, probably hadn't been fit quite right, didn't really like it.
Yeah.
But when we brought her in for exam, we're going to show you what the monovision was. We're going to show you the monovision I'm going to give you. Yeah.
And I'm still kind of getting used to it, but I know over time I'm very, very glad I did that. I also, the last few years, started having a lot of problems with my contacts because I go to Liberia on mission trips, and every year I'd have a problem with the sand and the long flights and everything, and I just said, you know, after the last couple times I said, I've got to do something, I've got to change this. And when my husband had his done 3 weeks ago, I saw the success that he had, and I said, I'm all in. I'm ready to do it. So, and Dr. Manger is the best. Dr. Wynn is the best. So if you're thinking about doing it, all I can say is just do it. That's great.
Thanks, Gail. Thank you. Roger?
Yeah, I'm Roger. I'm a recovering deputy chief of police of Los Angeles, so everybody can feel sorry for me on that. My whole career I had 2020, I was 2015, I turned 40, and I was like Eagle Eye. I could see, I could shoot, I was this. All of a sudden I turned 45, and one day I can't read the Wall Street Journal, I can't read above the fold of the LA Times, which is a good thing if you're in Los Angeles. You really don't like to see your name above the fold. So the thing for me was I started noticing my distance was going away. And I think you mentioned it, and my distance was starting to go away.
And the reading had gone away.
Oh, reading had gone away for a long time.
See, he's similar. His eyes are very similar.
And so I went to my ophthalmologist, who immediately told me I was farsighted, and you're not a candidate for laser, and LASIK. And he said the laser would not do you any good. And he told my wife that her correction was too great for the correction procedure for LASIK. So I waited and waited and waited and did the research, and I studied it, and it was not something I took lightly. And I found Dr. Manger. I found friends of mine had gone to Dr. Manger who had never known they had gone there and had this. I came in, and Dr. Manger said, well, you're farsighted, and the procedure's a little different. A lot of surgeons are not able to do this specialty that Dr. Manger specializes in. Dr. Nguyen did my exam, and Dr. Nguyen said, I'm going to set you up to get the good feeling for this, and because you wore progressive lenses, I bet you're really a great candidate for monovision. I did monovision. It's a blended monovision. I see now my little number on my watch. I see the dashboard of my car. I can read that license plate out there, and my distance right now is very good, but it's getting better and better, and I expect it to continue to get better for the next 3 to 6 months, but it's very good right now. So the bottom line is I'm very happy that I did. And it was a very life-changing procedure. One thing that you're going to have to get used to, after I had it done, I looked in the mirror, and Dr. Manger is too kind, but I now can see I need a lot of work. And he didn't really tell me, but I do need a lot of corrective work now. So, but I can see clearly. So it was a very life-changing experience.
You know, I don't know what you read in the Wall Street Journal, but you did read an article in the University of London.
Yes.
And I want you to share with them, because you shared that with me a few days ago. And
Well,
I want you to tell me,
and I'm trying
I
to-
want you to tell them what that article said, because
It's a
that
real-
article said something we've been telling the patients for 17 years. So
Well,
go
it was
ahead.
and one of the things it's talked about.
This was his research. He was researching LASIK.
And it was talking about and they were talking about nearsightedness and farsightedness, and they were talking about farsighted success rates in there. And they said farsighted can now be corrected, but they went through and they were given the success rate. And I'm thinking, well, I'm a farsighted guy who's had it done. I want to read up what the success is. And it was basically stating that it was a blend between art and science. And the blend was about 65% art of the surgeon and 35% of the science, because the technology is all at one level. It's sort of like a carpenter has a skill saw. Skill saws cut wood great doesn't mean that you're a good carpenter. So having a quality surgeon that has the ability, especially for me on farsightedness, this is very difficult, because a number of people will tell you they don't like doing farsighted people. So that was a thing, and that was in the London School of Medicine.
Be sure and forward that.
Yeah, and I've been looking for that, because I did it right after my surgery. I looked it up, and that was
That's a
pretty
great
good.
article, because we've been telling everybody that for years. I'm glad somebody else is saying it, yeah. Well, thank you very much,
you.
Roger. Thank you.
And next we have Sarah. She had LASIK just this past Tuesday, and before LASIK was $2,400, and now is $2,015.
Well, I guess, first off, the best part is that you can see. It's ridiculous. I mean, I've been talking about LASIK forever, and in my family there's 6 of us, so half of us are blind and half of us can see. And the ones that can see are always making fun of the blind ones, but it really does make a difference. It plays sports my whole life. And then I did this eye exam where I realized I was lining everything up with just my right eye. So I called my dad and I was like, okay, so my batting, my pitching, I remember you screaming at me not lining up with the plate. Probably because I couldn't see, and my contacts didn't correct my stigmatism, I'm guessing. So literally I can see, it looks like, someone said this the other day, someone said they heard that it looks like looking out of HD glasses, and I guess it's kind of true, because I feel like I see more detail outside, I see, my depth perception is a little bit better, I don't know why, but it's a miracle, like literally it feels like a miracle, and I had no clue how bad my vision was until it was corrected, and I knew that in my contacts it was never quite right, but you learned how to compensate for it, and now I'm realizing things that I used to do, like taking off these glasses even though they're not prescription. You always kind of like prep yourself to not see, so when I take it off and I can see, it's really a strange experience. It's so weird, but if you're contemplating it, if you're on the fence, just do it. I'm telling you, it's amazing, and I can't wait till these are off and I don't have to worry about wearing glasses ever again. Is that
Thank
good?
you, Sarah.
You're
That was great.
And now we have Joan, who had LASIK on the 6th of June. Before LASIK was $21,000,
2030.
Excuse me, just one thing on Sarah, because I was just thinking about what she was saying about lining up her eyes, and her right eye was seeing better than her left and everything. The reason for that was because she had twice as much astigmatism in the left eye, really high amount of astigmatism in the left eye, so her brain really preferred to suppress that left eye. So anyway, when we did the surgery, I removed all of the astigmatism, because I specialized in that for about 17 years too. So she had a little bit of astigmatism in the right eye. Obviously, we corrected that as well as the nearsighted. And then the left eye, we corrected all the nearsighted and all the astigmatism, which was a huge amount. So the thing now is your two eyes are balanced out. They're working together as well as they can. She still probably has a preference for that right eye because the brain learned that for many decades. So that's not going to go away. But the two eyes are balanced out. Almost equal. Okay, go ahead.
I started wearing glasses when I was 6 years old, and then graduated to contacts when I was 14. And then my contacts started really bothering me the last couple years. And then the ultimate disaster is I lost my contacts right before we were leaving on a big trip to Britain. I landed in England and had to get glasses quickly, and in this kind of prescription, it was like, oh gosh. So I did get them. So my whole trip in Britain was with glasses, and I got back here and I thought, oh, I'm going to let my eyes rest because I'd been having almost an allergic reaction to these hard lenses. So in the meantime, my yoga teacher said, come here. You got to have this. Well, I have astigmatism. I have old eyes. 1,000. How can I have LASIK? She said, do it. I had it. I had bad eyes. I had astigmatism. It's been corrected by Dr. Manger. How can this be? So, of course, I made an appointment, and I kept putting it off and putting it off. Finally, they said, okay, come for this. And so I came here and I listened to these professional people. I saw a professional outfit here. All these people are all professional. Found out Dr. Manger is the only one doing the procedure. There's nobody else doing it, and he just gives the big talk. He does it. So that to me, and back where you don't see the OR type rooms, is all professional. It's almost a mini hospital in here. So I really felt comfortable. Because this is a big decision to have somebody operating on your eyes. It was a big decision for me. And then for him to come in and say, you're a candidate, I was floored. I was just sure I wouldn't make it. And I was just speechless. And I said, okay, then we're doing it. That's it, I've got to do it now. Because at 65 years old, come on. So I made the big decision, and then afterwards, and I'm still like this last young lady. Every morning when I wake up and I can see, I'm just totally shocked. Because I was so used to waking up and it's like, where is everything? And I don't have to worry about losing my glasses or my contacts anymore. It's over. So I'm so pleased.
Thank you very much.
Thank you.
Because Joan and Gail, if you looked up here, 21,000 vision, they were both in the range of -7 to -9 nearsighted. A ton of nearsighted and some astigmatism. Interestingly enough, Joan chose no monovision and Gail chose monovision. Just a little difference. I think maybe you had worn the contacts and you'd worn reading glasses over contacts to correct you both for distance.
Yeah.
So you wanted to just do that. You didn't mind wearing the reading glasses. And Gail decided she wanted to do it without having to wear the reading glasses. So it's usually a perfect split of the people over 45 years old. About half of them will choose monovision and half of them will choose no monovision. We'll cover this later, but really it's a personal decision. You can't ask your spouse, you can't ask your sister, your brother. Everybody's life's totally different. Don't ask the opinion of somebody else. Our optometrists spend 15 minutes on that exam, and they will show you what the monovision and judge it. We can read you. We can read you. On whether you're the kind of person that's gonna like it, or whether you're the person that's not gonna like it. So, and the other thing is, it came up, because I know several of the speakers said they were told they're not a candidate someplace else. Happens all day long, okay? But just know that actually, you know, they were very happy they were candidates. There are 20% of the people that come in here that are not candidates for LASIK, so we have to tell them they're not candidates, unfortunately. It's very disappointing for them and for us, but mostly for them. So, not everybody's a candidate, okay, but 80% of the people that come in here for a LASIK exam are candidates for LASIK. Okay, go ahead, Steph.
Good morning.